The House resumed plenary sittings for the second session after 6 weeks of recess. Among the items on the order paper was the Uganda Human Organ Donation and Transplant Bill 2021, tabled by the Health Minister Jane Ruth Acheng. The bill seeks to regulate organ, cell and tissue donation and transplant in Uganda through establishing the Uganda Organ and Transplant Council, designating Mulago National Referral Hospital as the pioneering transplant center, regulate the conduct of donation and transplant activities, design standards for storage of harvested organs, tissues and cells, prescribe the appropriate consent to be given by the donors, establish a human organ and tissue database and reporting requirements, and prescribe offenses and punishments related to issues of organ and tissue donation and transplantation, among others.
So we do hope that the committee that will consider the bill will look at it in its entirety, and the public will be called upon to give in their contributions so that we can have a law that can regulate organ donation and transplant in this country.
We want to ensure that we have a very solid bill that will protect both the patients and the health workers, the people who are doing the organ harvesting and consequently the organ transplant.
The bill seeks to set stringent punishments, including life imprisonment for commercial dealings in human materials such as a sale of one of the pairs of organs, such as an eye or kidney of a living donor, 12 years imprisonment or a fine of 2 billion shillings for removal of human organ, cell or tissue without authority, 12 years imprisonment or a fine of 2 billion shillings for organ, tissue or cell trade or trafficking, and life imprisonment for removal of human organ, tissue or cell from a living donor without consent or authorization.
The bill is also looking at ways of having storage for the organs, but also ensure that we address the issues of illicit trade that people keep on talking about every now and then.
If there is any case whereby there is an offense committed, it's not only the organization that will be held culpable, it is also the individuals, the managers, the heads of all those organizations will be held culpable.
We are mindful of the black market concerning the sale of organs illegally, and that's why we want to ensure that the law is foolproof and it's a strong one, and there should be punitive measures for any people who are caught in the black market.
The bill also gives a person a right to withdraw his or her consent to donate an organ at any time without any justification before harvesting such an organ. The bill has been sent to the Health Committee for processing within 45 days. Habad Ziwa, NTV at Parliament.